Malaysia, concern over the nutritional quality of food in Malaysia have intensified as the nation face a worrying shift in dietary pattern. The increasing availability and consumption of processed food, often high in sugar, salts, and fat, have significantly shaped the country's food environment, particularly among lower income groups. As highlighted in the KRI discussion paper on food environment and nutritional inequality, Malaysia is now grappling with the double burden of malnutrition, where undernutrition coexists with rising rates of obesity and diet-related non-communicable disease. This alarming trend reflects not only unhealthy food choices but also systemic issues in food accessibility, affordability, and regulation.
Hi everyone, today I would like to talk about food in Malaysia. Many of us love tasty food like fast food, snacks and sweet drinks. But a lot of these foods have too much of sugar and salt in it. Eating too much can make us sick. We can also get problems like diabetes, high blood pressure and obesity. So, the government is trying to help us. They made some rules or policies to protect our health. One of the policy is sugar tax. This means that the drinks with a lot of sugar content get high tax and it costs more. It helps people to drink less sweet drinks. Other policy is about food label. Now, when we buy food at the stores, we can see how much the content of sugar, salt, and fat in it. So it helps us or help the consumer to buy the healthier food compared to more sugar, salt, and fat that can harm our health. In school, there is a healthy canteen policy. Schools are told to sell more organic and healthy food like fruits and vegetables. However, schools didn't allow to sell most junk food such as like fried foods or snacks to the students. There is also a campaign called as Suku Suku Separuh. It shows us how to eat balanced meal like 1/4 of rice, 1/4 of protein like chicken or fish, and half plate of vegetables and fruits. So, these are some good steps to help Malaysia eat better and live healthier. But it's not only government's job. We also need to take care of our own self and our own food. Try to drink more water, eat more fresh food and less junk food. Thank you for listening. Let's try to eat better and stay healthier. Thank you.
Assalamualaikum and hi. Today I would like to talk about nutritional quality in Malaysia. As we know nowadays, many food that has been processed and it can affect the nutritional quality of foods because it contains high levels of sugar, salt and also fat. In my talk today, I will discuss how different socioeconomic aspects including food affordability, time property, model food delivery system and nutritional inequality. The first one is food affordability and financial constraints. For this processed food that contains high in fat, sugar and salt is widely available in our country with many variable brands, while fresh fruits and vegetables remain comparatively expensive. It is unhealthy and usually be available options and choice for those with financial constraints. This leads to the adoption of unhealthy diets among the group. The second is time property. Individuals who are time poor, such as working for long hours, or doing multiple jobs gravitate toward affordable convenience foods. The meals are not cooked at home, which is buy from restaurant or processed food. It's typically offer lower nutritional quality and higher in energy content. But not having enough time to cook at home lead this to happen and the sugar or salt level in the body is increasing. The third is impact of modern food retail and delivery. A growing access to online food delivery exacerbates the availability of unhealthy foods, especially impacting those seeking convenience due to their work or lifestyle pressure. By consuming unhealthy food frequently, high potential for Malaysians to get lower nutritional quality in their life and increasing the risk of getting any serious disease. Lastly, nutritional inequality. The disadvantages for groups that having a low income and lack of time are most affected for getting low nutritional quality in their meal intake. The marketing of unhealthy food is also expanded because get many supporters. For reducing the socioeconomic challenges, make a lot of healthier food affordable, accessible, desirable, and competitive with unhealthy options. Can also pairing consumer education with food environment system reforms such as subsidies for healthier food, pricing policies, and improve food availability in underserved areas. With this, the dependence on low nutrient and unhealthy foods can be reduced.
Now, let's talk about current status of nutritional quality. Firstly, unhealthy food environment are increasingly prevalent. In Malaysia, the current food environment strongly encourages unhealthy food consumption and will contribute to the increase in non-communicable disease such as obesity and diabetes. Highly processed food rich in sugar, salts and fat are readily available and affordable. These products are found everywhere, such as in supermarket, grocery store, fast food chain, and especially through food delivery apps. Because these foods are more convenient and widely promoted, people are more likely to choose them over healthy options such as fruit, vegetable, or home-cooked meals. Next, the increasing double burden of malnutrition. Malaysia is experiencing what is known as the double burden of malnutrition. This means that both undernutrition and overnutrition exist side by side. For example, many children are stunted, which is poor growth due to chronic malnutrition, which has increased from 17.2% in 2006 to 20.7% in 2016. At the same time, more adults are overweight or obese, and about 4.9 million adults have anemia, a sign of poor iron intake. This suggests that people are eating enough or too much food but not getting the right nutrient. Moreover, technology makes unhealthy food easier. For example, online food delivery platforms like GrabFood and Foodpanda have made it easier than ever to buy food, but much of what is on offer is unhealthy. This platform frequently promote fast food, sugary drinks, and fried items, often with discount and bundle deals. This convenience combined with aggressive marketing is driving people to order unhealthy food more often, especially those who are busy, tired, or don't have time to cook.
Step to overcome the issue. To address the growing concern of poor nutrition quality and unhealthy food environment in Malaysia, several key steps must be taken. First, the government must implement strong and comprehensive food policies that is including mandatory and clear food labeling, restriction on healthy food, information targeting children and sugar test on sweeter behavior and friendly effort for healthy food production and consumption. Second, there must be great support for available access to nutrition food, fruit and vegetable which are often special and in limited supply should be surprising and made weekly available in school, market and public station. Third, nutrition education must be strengthened for School to community central Malaysia need to be education about the importance for balanced diet and the risk of high sugar, high fat and processed food. Fourth, the private sector, especially food delivery platform, must be encouraged to provide healthy opinion and share aggressive promotion of unhealthy meals. And finally, we must buy healthy food environment in public setting, including school, hospital, workplace and retail space, to ensure that healthy choices are the easy and accessible ones for everyone. In conclusion, Malaysia is facing a complex nutrition crisis where food undernutrition and our consumption of unhealthy food are on the rise. Our current food environment refer with cheap, processed and easily accessible meat is shaping unhealthy eating habit, especially among low-income group and youth. This is not just an issue of personal choice, it is a recession of deeper systematic failures our food policy and supply system. Therefore, change must happen at multiple levels through strong government regulation, ongoing consumer education and cooperation with the private sector and communication. If we are truly communication regulated diet really essential and improve national healthy, we must restructure our food environment into one that is healthy, fair and more sustainable. The father of our national healthy depends on the action we take today. A healthy Malaysia start with a healthy food system. The time to actually is now.